active range of motion of the knee. So the knee has 4 basic motions. 2 are primary and 2 are kind of secondary motions. It acts as primarily a hinge joint, which means it functions primarily in one plane. So the 2 main movements are going to be knee extension, which is where my leg straightens, and knee flexion. Active range of motion, just extending the leg back and forth. It also does internal and external rotation. Easiest way to do this, I find, is to plant your heel and to fix the top of your foot, and then use my toe as kind of like a pendulum back and forth. So I turn one way and turn the other way. Not a ton of rotation, but there should be at least a little bit of rotation. Okay? Range of motion is going to vary from person to person, but you should be able to, as a general rule, get your heel pretty stinking close to your bum and get the back of your knee pressing into the floor, which we call terminal knee extension. Active range of motion is really important after injury because we want to preserve as much range of motion as we can. Using your hands to do some passive range of motion is helpful, but active range of motion is going to be the number one thing. So active is going to help clear the swelling. It helps preserve a lot of that movement. If we don't move it, we lose it. We want to keep moving as much as we can. So active knee range of motion.